I have two daughters who experienced very serious mental health problems during adolescence and early adulthood. And as their mother, I was their primary support person. During the years that they were very ill, I experienced on a number of occasions being shut out of the process of assessment and treatment.
Right from the beginning, we're asking people who's important to you, who do you define as family, who would you like involved in helping to facilitate your recovery. So I think it gives people both the permission to include them and the expectation, maybe for some, that people are important in your recovery and you can't do this alone and you need your circle of support.
We knew that if we collaborated differently with consumers and families, that the outcomes for those individuals living with mental illness and their support network would improve substantially. And so having those voices at the table throughout the process was going to result in a much better outcome for the work that we were doing.
My organization has been involved with this initiative for probably since 2005. And what has happened recently within the last year is that it has grown in leaps and bounds. Now, every aspect of the mental health program is impacted with the voices and the ideas and the input from consumers who live with mental illness and from family members. So that is the biggest change, and it's embedded in the program.
What do I see in the future? I see a smaller waiting line. I see more independent housing. I see more resources in the community. I see a better communication system and more trust and less stigma.
5 to 10 years down the road, I can see that throughout our whole program, on a day-to-day clinical basis, families will be involved with clinical staff members in terms of making decisions and planning for their family members. And I can see it as simply being part of our day-to-day work as opposed to something we have to think about or add on.